Hi, ladies and gentlemen. Welcome back to Brain Gist. My last video had to do with Bell's palsy. Today, I'm going to talk about what I've titled "What Else to Know About Bell's Palsy." So I'll be telling us more about this condition and some other features that I didn't talk about in my previous video, which I need to add up to it to make it a complete discussion on Bell's palsy. And then you can ask me any questions you have in the comment section. I'll be glad to respond. So before I go into that, I'd like to welcome you back to the channel. And then for those who probably are watching for the first time, this is Brain Gist. It's a channel created to give people authentic information about the brain and all of its disorders, as well as the things that have to do with the spinal cord, the nerves, the muscles, everything that has to do with the nervous system. So if you haven't subscribed yet, please hit that button so you can stay connected. And of course, don't forget to turn on the notification so you can get notified when subsequent videos are released, and you can browse through the list of videos and catch up on all the things we've talked about in the past. So today I want to talk about what else you need to know about Bell's palsy. So in the introductory video I made probably 2 weeks ago now, or 3, on Bell's palsy, I emphasized the dominant presentation of Bell's palsy, and that's weakness on one side of the face, and that has to do with an inflammatory lesion of a facial nerve. So today, besides the weakness, there are a few other things that can co-occur in people who've got Bell's palsy, and those depending on the degree or severity of a Bell's palsy. So some people will have a severe or a more complete picture of Bell's palsy could have sound being magnified on one side and on that side. So when they listen to music or somebody speaks or makes noise around them, it tends to be louder in that ear. So, and it has to do with the fact that that nerve, the facial nerve, has got a branch which goes to stabilize one of the muscles that help to moderate sound perception in the middle part of the ear. And that when that muscle is deprived of its innervation because of Bell's palsy, and that muscle vibrates beyond what is normal, and that gives a sense of amplification, what in medical parlance we call hyperacusis. So sound is magnified there. And then the other thing beyond the weakness is taste. So some patients will complain of metallic taste or loss of taste on their tongue. And one fascinating thing is, if you are able to actually get something like a sweet tasted material and you put on the tongue on that side, you may not taste it, but if you're able to be careful enough to put it on the other side of the tongue, the other half of the tongue, you'll be able to taste it. So it has to do with the fact that the front part of the tongue, the front 2/3 of the tongue, receives its its supply or its nerve supply or by that same nerve. So the taste information from the tongue to the brain, it goes through that nerve. So that helps to complete the picture of presentation of facial nerve injury or Bell's palsy that we're talking about. Now, some patients do come to the clinic and asking if we could do MRI for them to be sure they don't have a stroke. But most of the time we're able to tell from the clinical presentation and examination if this is Bell's palsy or it's a stroke. So we're able to distinguish the two. For some patients, because of high level of anxiety or perhaps other reasons, would ask us to do a brain MRI for them to be sure that they don't have a stroke. So, well, sometimes we oblige and we do brain MRI, but brain MRI would usually be normal because this is not a disease of the brain. It's a disease of the nerve, which is an offshoot of the brain that helps to control the face and these other functions I've talked about. So, but we usually wouldn't do brain MRI for such situations, but for those who want to insist in it, then we do that. And then the golden test usually will be, if you have to test at all, that will be nerve conductions, and that there's a particular type of nerve conduction we call the blink reflex, which perhaps is even more useful than the nerve conductions. But perhaps we take the information together, because with the nerve conduction of the facial nerve and the blink reflex, we're able to tell. If we synthesize the information from both aspects of the test, we're able to tell for sure that this is facial nerve disease and not a brain disease. And we're able to determine the degree of injury that has occurred to the nerve as a result of this inflammation. And therefore we can tell and predict the likelihood of recovery and the extent of recovery, and then the speed of recovery, depending on what we see on the test. So sometimes, for example, in the last 1 month, I've probably seen up to 4 cases of Bell's palsy. And fortunately for all of them, the test actually showed that the nerve was not severely affected, and I could prognosticate from the test findings how quickly they would recover and how completely they would recover. And all of them, fortunately, had very benign and mild affectation of the facial nerve, and I was able to predict that they would do quite well on steroids. And like one of them actually within a month had made a very dramatic improvement in the weakness on their face rather. So thank you so much for watching today. I look forward to bringing you interesting videos again in the future. But before you go, please subscribe and stay connected. So thanks for watching today, and I'll see you in my next video. Bye.